Welcome to Flip Your Script, the vodcast from the American College of Lifestyle Medicine that's all about clinicians redefining care through innovation, leadership, and lifestyle medicine. My name is Dr. Padmaja Patel, and I'm the current president of the American College of Lifestyle Medicine and serve as Chief Medical Officer of Nudge Health. Each episode delivers 5 key takeaways from leading experts and practitioners on how lifestyle medicine is reshaping the future of healthcare. Through proven strategies and real-world success stories, we equip you with the tools to drive meaningful, lasting change in your health, your practice, and your leadership. In this episode, we're honored to be joined by Doctors Merlo and Ramaswamy Viswanathan. Dr. Merlo is a clinical professor of psychiatry at NYU Grossman School of Medicine and an associate editor of the American Journal of Lifestyle Medicine. She's a fellow of the American College of Lifestyle Medicine and a distinguished fellow of the American Psychiatric Association, where she's the founding chair of the APA Caucus on Lifestyle Psychiatry, chairs the Lifestyle Psychiatry Work Group, and serves on the annual meeting Scientific Program Committee. Dr. Merlo is a past chair of ACLM's Mental and Behavioral Health Member Interest Group and a contributing author to ACLM's Board Review course. She has authored 4 academic books on medical professionalism and lifestyle medicine, including Lifestyle Psychiatry through the lens of behavioral science. She's also the author of Restack, a general audience book offering practical tools to embrace imperfection and foster psychological freedom. Dr. Ramaswamy Viswanathan served as president of the American Psychiatric Association from May 2024 to May 2025 and chose as his presidential theme Lifestyle for Positive Mental and Physical Health. He elevated lifestyle medicine across psychiatry through making it as a major focus of the 2025 APA annual meeting and a September 2024 Community Psychiatry Conference, and by appointing the APA Presidential Work Group on Lifestyle Psychiatry, which produced a comprehensive, multi-author, evidence-informed report on the importance of the 6 pillars of lifestyle medicine to the field of psychiatry. Dr. Viswanathan is board certified in internal medicine, psychiatry, consultation, liaison psychiatry, geriatric psychiatry, addiction psychiatry, forensic psychiatry, and lifestyle medicine. He's professor of psychiatry and behavioral sciences at SUNY Downstate. An internationally recognized lecturer and researcher, he has received numerous national awards for education, service, and leadership, and has been listed in Castle Connolly's Best Doctors since 1994. Welcome, Jia and Ramaswamy. How are you doing today?
Wonderful. Thank you so much for having us here today. We're so excited to be here and to be able to share and think with you together on this podcast. Vodcast. What is it? Vodcast?
Yeah, it's really indeed a pleasure and actually a privilege to be invited.
Well, thank you. Thank you for taking the time. So let me start. Before lifestyle medicine had a momentum within psychiatry, what first drew each of you to this work? And what moment made you realize it could truly flip the script for mental health? And whoever wants to start.
Okay, yeah, I can go ahead. Okay, thank you. Actually, for me, my interest started in a very early childhood, because unfortunately, my father died of a sudden heart attack at age 42 when I was only 2 years old. And to this date, one of my regrets is, I don't have any memory of my father. So right from childhood, I was interested in prevention. And I was fortunate in my adolescence to come across the magazine Reader's Digest in my uncle's home. it had plenty of articles which would be considered nowadays as lifestyle medicine. And so it focused a lot on physical activity and not smoking, and also the nutrition. And so I was always interested in preventive health. And then what happened was, with my treating my patients, and I'm certified, and I'm interested in the whole of medicine. So with my psychiatric patients, I was always interested in their whole health, including physical health. Then as they were improving in their physical health, I also noticed not only their functionality and vitality improved, their whole, the mental symptoms also improved. Right. And then I, began coming across studies, especially, the physical activity. There are really astounding studies showing the benefits, not simply feel-good hormones and all, the chemicals that we know, but actually neuroplastic changes, the hippocampus growth, and how that is related to improvement in depression and even schizophrenia. And so that's what flipped the switch for me.
Wonderful. Gia, what would you add?
Yeah, wow. So this is why I let Dr. Viz go first, because he has such a beautiful, comprehensive story. My story is similar, but I'm just going to point out the differences just for a little difference in narrative here. So I actually started, I've been very interested in this process as a practicing child and adult and an adolescent psychiatrist. I started noticing that, there were some parents that would come in, and I would treat a lot of physicians and physicians' kids, and they would come in and say, I don't want to give my child medication. They're having all these behavioral problems. They're throwing desks in schools. They're not able to stay. They're getting all these detentions and all these sort of problems. Right. And so I had a choice. I could continue to see them, or I would say, if you don't agree to medication, I can't treat you. I took that chance. I said, these are physicians, they're their kids. And then I would do these sort of lifestyle interventions with these children. And though the number of patients I treated is not large, but there was enough where I saw the changes, and I went, oh, wait a second. And this was 30, 40 years ago. So I kept doing that and having that part of my practice. I was very interested in psychoanalysis and psychotherapy. I started psychoanalytic training. I didn't complete that because of my daughter, and I became very important for me to take care of the family. But what I realized through my practice, and it evolved because I also treated as adults, is I saw the slippery slope that a lot of physicians ended up going into, where they were doing professionalism violations. And then they ended up losing their careers based on some of the things they were doing. So my initial interest in this was through medical professionalism, and not the way that we think about it, 101, do this, don't do this. It was, we need to focus on clinicians' well-being and and in concert with our patients. And that's how I came across as financial well-being, well-being of our relationships, connectedness, as I call it. And we'll talk some more about that later, but also the nutrition, the exercise, and all those aspects. When I started teaching that to undergraduate students to understand how we can possibly nip it in the bud before it became a whole issue, that's when I discovered lifestyle psychiatry, lifestyle medicine. I realized that we also, in the lifestyle medicine, have a lot to contribute as psychiatrists to the field. And that's when I really put my lens into the lifestyle psychiatry, and how can we get psychiatrists involved in this movement and also be able to be part of the conversation. Because, of all the disorders that we have in the world, and especially in this country, a lot of disability and the issues that we have for patients are around psychiatric disorders, depression, anxiety, and this is about quality of life. And also, we know that they work, these interventions for psychiatry. So that's how I started, in my mind, flipping the switch.
Yeah. And I think I can resonate with that story about seeing the impact of lifestyle medicine on our patients. I think that's the most powerful evidence for us as clinicians right there, and it's hard to overlook. So I could definitely relate to those powerful stories. I know you both have worked at the highest levels of organized medicine. So, Dr. Viswanathan, what are you seeing right now that signals the real cultural shift toward root cause treatment, remission, and prevention, our foundational principles of lifestyle medicine? And why does lifestyle medicine resonate across different specialties? What are your thoughts on that?
One thing I realized, when I was privileged to become a president of the American Psychiatric Association, which is the world's largest professional psychiatric organization with about 39,000 members. And, also its annual meetings attract, before COVID, it used to attract 17,000 people. Now it attracts 10,000 people. I realized suddenly I was in a position where I can have a substantial influence on the practice of psychiatry. And I realized I could have a transformative impact because of my interest in lifestyle medicine, because usually the meetings and most of our education, they are focused on biological psychiatry and psychotherapy, which are very important components of treatment. So I made my theme for my presidential year and annual meeting, a lifestyle for positive mental and physical health. And initially, I met with some negative comments for people, who simply, many people are not familiar with the evidence base behind it. They simply think, okay, sounds good. So that, in fact, made me even stronger in my resolve. I have to have it as my theme, because to bring home the tremendous evidence, like many people are ignorant about. And I was also fortunate, timing-wise. This is the time when GIA formed the Lifestyle Psychiatry Caucus, and I happened to be on the committee which had to approve it, and I approved it, and that worked out very well. And also, I appointed a presidential work group, and I appointed GIA as its a chair, and she really assembled a wonderful work group, which really energized a lot of people, more than 100 people on different study groups for each pillar. And, they really produced an excellent resource document. And in addition to that, we also had many webinars, and both through the caucus the GIA had, as well as, through the APA, officially. And also we have a community psychiatry meeting, which happened earlier than the annual meeting. And many people, they are under the false impression that lifestyle is for the rich and privileged, right? So when I made this, that's the theme for the community psychiatry, there was some criticism, and then I drove home the point. Actually, the meeting was a good venue when you're talking about lifestyle. Many people think it's expensive. Look at the sugary drinks, which our poor patients, drink, and if they cut it out, it not only saves money, but it also saves their health. So, we also address the social determinants of health. But anyway, the thing is, once we made this a theme, it really brought in, people really came from the woodworks. A lot of people had hidden interest in lifestyle medicine, but they never had an opportunity to come together and express. The meeting was enormously successful. I also had the privilege of interviewing tennis legend Venus Williams in front of an audience of about 5,000 people. And she has adopted a vegan diet. And of course, she's a spokesperson for mental health and physical activity. And about 60 of the 450 sessions in the annual meeting were lifestyle focused. And people, many people actually were thrilled. Many people attended the meeting because of the theme. And many people would stop me on the hallway and express their feedback about how good it was. And in terms of the transformative impact, I also have been, as president of the APA, I was invited to give lectures in the Royal College of Psychiatrists in Edinburgh, and then in Canberra, Japan, Philippines, Papua New Guinea, and I always give the lecture on lifestyle, same theme, lifestyle for positive mental and physical health. And I wasn't prepared. Countries like Australia, they were leaders in lifestyle medicine, and even there, there's a gap between what the practice guidelines and what the average psychiatrist knows. And many people would come to me after the lecture and said how transformative it was for them. There are people who emailed me that they went home and made their partner watch the recording, or they rewatched the recording. And there are also, I got an email from somebody in Korea who had listened to my lecture in Japan, and he went back to Korea and instituted lifestyle changes, incorporated it in his psychiatric clinic. And it was so good, then he also is connected with 6 other psychiatrist clinics in Korea. So all of those clinics, they are incorporating lifestyle psychiatry in their practice. Yeah. So it's quite, pleasing. I owe a lot, to, there's a synergy between Gia and me. We work together, and together we have accomplished much more than what each of us could have achieved single-handedly. So thank you, Gia, for that.
Thank you. Thank you. Can I just say something really quickly?
Yeah, please.
Without Dr. Viz and Viz, I have so much fondness for him. He brought this to international, in neon lights. And it was beautiful because without someone as articulate and able to go into all these different places and say, wait a second, I have 5 board certifications in psychiatry. I'm the president of the APA. I know that psychopharmacology is what we need to be doing for our patients, but there's a lot of role in adjunctive treatments for lifestyle interventions for patients, and there's so many pieces that I could never have done alone. But I think just to add to that for a second about where we're going in the future, because Viz and I have other projects that we're also working on. And I think just to add the second pair, I think that education and then the way we're moving this forward to continue the momentum is really important. And I think that now through these committees and this caucuses, we're now working towards creating actually curricula that residencies can adopt. They're asking us for psychiatry residency training programs. So we have a committee where we're getting that formed together. We're getting very close to creating a curriculum. Also, in addition to that, I have the one textbook of lifestyle psychiatry, but I think that we also are working on doing a clinical handbook so that we can have that for the bedside for the primary care physician and for the psychiatrist. I think the key point that I like to drive home, and as we're thinking about what role psychiatrists can play in the lifestyle medicine and now the lifestyle psychiatry movement, is there are gaps in the knowledge base of primary care physicians and specialists that psychiatrists can contribute. And I think that that's really important to understand, that we're not saying that you always have to refer to a lifestyle psychiatrist, but in your practice, you can adapt these other things based on our experiences. And and those gaps are very important and vital, and they may actually lead to more adherence with patients and actually expand the construct of motivational interviewing to also address some of the blocks and the internal barriers and external barriers that patients may have to actually engaging in these lifestyles and sustaining the change.
Yes.
And one more thing, about, obviously the continuity is important. And we are finding that after the annual meeting, we are also being invited by many medical centers, to give lectures on lifestyle psychiatry, which, again, along with the curriculum development, I think this again is an important way of spreading the message.
Yeah, I do 1 to 4 lectures a week. So I'm going and talking to residents and fellows and doing CME activity. And it's just beautiful. I never say no. People are like, we can only offer you this. I would do it for free. Let me just go out there and speak to you. I'll speak to anybody that will listen to us. So it's all fun.
Yeah, well, honestly, I would say both of you are truly trailblazers. You had this vision and you are truly transforming how care can be delivered across different specialties and connecting the dots between lifestyle medicine and psychiatry, and this momentum that you've created nationally, but also internationally, and this awareness. So thank you for all that amazing work that you've done. So let's come to lifestyle psychiatry. I know that it emphasizes self-connection, emotional resilience, nature, and social connections, areas which often are overlooked in clinical practice. So, Dr. Merlo, how can clinicians realistically integrate these principles into everyday practice? Because that's the most challenging part, right? We can always write books and have tools, but how do you bring down to the real world implementation?
Beautiful question. Thank you, Padmaja. So I think just for a quick 1 minute summary. So I think the pillar that and I'm so glad that ACLM follows suit. I really strongly believe from my psychiatric lens and my psychological lens that the way that I conceptualize connection, and it's called connectedness in the way that I look, it's 3 levels: our connection to ourselves, connection to others, and connection to the world. Because I think if we just focus on social connection, we're missing the other pieces. And in that, I define 6 domains: happiness, purpose in life, meaning making, which is actually extremely pivotal for the older adults. I know my 93-year-old father, without purpose in life and meaning making, for this man who was very vibrant, very active with his whole life, now he needs a reason to wake up every morning. And without that, we're not going, and without that connection to himself, he's not going to be able to have a flourish in his life. Empathy and compassion, including self-empathy and compassion, then of course social connection, and then spirituality and religion and nature. So I just define the 6 domains as the way I see it in connectedness. And when you have defined it in that way, then we can talk about practical implications, because I do want to answer your question. So when I see a patient, even though we may have limited time in them, I do ask very quick questions on these 6 domains. It takes 2 minutes. It takes me 2 minutes. And the idea is that if we don't bring these up in our first evaluation with the patients, whatever specialty you are, patients don't know that that's available for conversation. And that, I can tell you as a psychiatrist, it's really important pivot point where when you start changing the whole flow of what you can offer. There are 4 questions for spirituality and religion. Do you have an organized religion? Is it something that you practice every day? Is it something that you have resources, or where have you started with this? And do you want to talk to me about it? Yes, no, very simple. Because if they say, no, I don't want that integrated into my care, 70 to 80% of the population want and have a spiritual or a religious bent. They kind of wonder why we can't talk about it in healthcare. So I have a very, very practical way of addressing that and potentially helping. It can help patients. Purpose in life and meaning making, of course, asking those questions. Nature, there's a lot of data how you can act. There's the phytonutrients, all those aspects of nature, and even looking at pictures of greenery in the back when you're doing taking a 30-second break and looking up and increasing your vision can actually be very helpful. Social connection, I think we know a lot about how that's important. Self-empathy and compassion, just really being able to take a step back. There's a lot of self-compassion sort of literature out there. There's some free resources that I put on my website that people can grab and look at. Happiness, and not just the hedonistic happiness, but that sort of contentment that we can have and how we can get there. So those practical pieces, talking to patients about it, bringing it up in conversation, I think is pivotal in this lifestyle movement.
So do you
Just to add to what Gia has said, in psychiatry, there is a psychotherapy. There's a school of psychotherapy called logotherapy, which was formulated by Viktor Frankl. After he survived the concentration camp, and that has been around since the 40s. Regrettably, it's not at all taught in most departments. People who are interested, like me, we learned on our own. I do, think, I definitely help people find meaning, and that's an important that I think we need to promote within psychiatry itself. As Gia was mentioning, and also the other thing which is tricky. Traditionally, unfortunately, psychiatrists were trained, to kind of stay away from religion. And as Gia pointed out, actually, I have done studies where I found, 85%, I did a study on connection between religious attitude and assisted suicide in terminally AIDS patients. And I wanted to see the connection, between religion, belief in God. And in that sample, I found 85% of the patients had strong or moderate belief in God. So it's a very important aspect of our patients' lives. The trick here is when you are dealing with people of different religious faith, how to
Yes.
use that in psychotherapy. And I have a lot of people, when I treat people of the Orthodox Jewish faith, I am able to get into their world empathically. And the same is true with Jehovah's Witnesses, with the people of the Islamic faith. And that's one of the things, we have to recognize the positive aspect of each religion. And also, and it's an important aspect of the individual for most people. Obviously, there are people who are not interested in religion. We have to respect that also. So, thank you, GR, again, for bringing it and emphasizing it more. And that's a very important work.
And it's so funny.
Yeah.
Just one thought. It's so funny because every time I talk about religion and spirituality with the patient, they all think I'm their religion because my knowledge and my interest is so profound.
Yeah.
And that's the beauty of it. It's not about our bias. It's about what our patients need.
Right. Right. So let me just quickly ask you about those questions that you just mentioned to be perhaps added into routine assessments. Have you created sort of a template that people can access? Is it available on your website? I just wanted to see if someone is interested in incorporating these questions, where do they find them?
So, I'm pedaling as fast as I can. So I'll answer that question with what I have and what we're going. After this lifestyle psychiatry textbook came out, I had preeminent authors from psychology and psychiatry help move this forward. And it was beautiful. It was an edited volume. But then I realized the minute I saw all the chapters come in, I can't avoid writing this for the general audience. So that's what my Restack book is. So my Restack book is what I did was I did what I called them as RXs, prescriptions that it's a self-help book. So you can grab that, read this prescription, and then go through the book. There are 50 to 80 to 90 prescriptions in there. There are tables in there. And so that's a self-help book that you can actually use that incorporates everything I just talked about. Plus. Because it also talks about emotional regulation, cognitive, blocks that we may have, social determinants of health. All those are added in there. Now, what we're doing next, so that's already out there. That's in print. It's available on Amazon. What we're doing next is trying to create a handbook from that would be available for the clinician as well. My experience is that people find that useful, that book. If you go to my website, everything on my website is free. It's glmerlo.com. And you go to the top and you go down to resources, and I have a lot of options there. That is the current best way to get the most information on everything we just talked about. In addition, I did write some papers that are freely available in the American Journal of Lifestyle Medicine on this topic. So those are freely available. If you can't access them, send me an email. I'll send them to you. I have no problem with that. gmerlomd@gmail.com. Please send me. The next 3 to 5 years, the goal is to produce everything that you're talking about. So we're taking all the beautiful curriculum and the ideas that ACLM has created, but we're actually doing that within the lens of the psychiatrist, not exactly the same, but that would be available for primary care physician specialists, but also for the psychiatric mental health community. And we haven't done the handouts yet. That's going to be in the works. Where I'm really looking at 2 years where we'll have something in print.
And in terms of a psychiatrist in particular, one of the things we have done is the presidential work group chaired by GRP. We developed a resource document, and we have made it available on the website. Right now it's available only to the members. Eventually, we want it to be available to everybody, even the public.
Wonderful.
And that has obviously gets into all the elements, all the pillars and the relevance to psychiatry.
Yeah, it's like hundreds of pages, Padmaja. It was a massive undertaking. It was fun.
Well, thank you. So before we conclude, very quickly, if I ask you, there are many clinicians who are listening today to your talk. If they're interested in advocating lifestyle medicine within their institutions or professional communities, where should they start, and what advice you have for them?
I can start first with that. So, I think partnering with like-minded humans is probably the most important thing. You need to have that support as you're doing it forward. I could not have moved this forward without Steve Sugden, who has been my partner he was the co-chair of the member interest group at ACLM. We started this work together 5, 7, 8, 10 years ago. I can't even remember now. But, every time I think of something, I pick up the phone and call him. And then we were so privileged then to have partnered with Dr. Viswanathan. So without Dr. Viz, without Steve, I think that you need to have those people that you can bounce ideas off of. And the second thing I would say is then go with your area of expertise. Go with what your heart is saying to do, because if you don't have the passion for what you need to do going forward, you're gonna just peter out. Dr. Viz has that leadership. He's able to have that vision, be able to, he was already there in the APA. He went with it. Boom. That's what he does, and I was doing the writing, the American Journal of Lifestyle Medicine was able to really engage the audience in writing different books and doing that. That's what I was focusing on. And Steve, the same way, he's an addiction psychiatrist, was able to move these constructs even to the addiction world. So I think the partnering and then mentoring. So in this process of doing the study groups and everything, I mentored, 100+ people in lifestyle medicine and lifestyle psychiatry, because you will not move this forward by yourself. You need people that can become experts really quickly. And that to me was brilliant. We have ACLM, we have a body of knowledge. Get everybody from the APA to become a member of the ACLM, learn that body of knowledge before you can build on it in your special organizations. That's, I think, the path forward. Because if you're trying to build in psychiatry without that basis of the knowledge, what we have in ACLM, I think we're not going to succeed.
I love that.
Going along with what Chia said, important thing which we are doing is actually bringing APA and ACLM together, which Padmaja you are familiar with. I think that will be a win-win situation. We'll have a very powerful impact. And one more thing, for the individuals to think about, apart from forming groups within their own institutions, also is you have to lead by example. Yes. And some of us are in positions wherein we can have a lot of impact on others. I am a consultation liaison psychiatrist, and we'll see a patient in the emergency room in the level 1, and then there may be consultations, on the 6th floor and 8th floor. I prefer taking the stairs. I tell my students and residents, usually about 8 people, young people in their 20s. So, I give them an option, but because I am taking the stairs, so from the first floor, we walk up to the 8th floor. And I tell them also, like osteoporosis, sarcopenia, dementia, atherosclerosis, everything starts at your age. You have to start the prevention. So I use that as an opportunity also to teach them not only physical activity, also I tell them about the nutrition, which many of them don't have a clue about the things which we talk about. I think, people that again will attract like-minded people together to form groups also.
Yes. Well,
can I say one more thing? Okay, so I think I want to end this part of this, just say one more thing. In psychiatry, historically, we've been very adaptive with data that's come out. We know that psychotherapy is effective. We know that somatic treatments are oftentimes effective. We know that psychopharmacology is oftentimes effective. What we're doing with the lifestyle psychiatry movement is we're adding the 4th major tool to the toolbox. And what we're suggesting is we have been remiss in not having this available. We all know that eating well, exercising, social connections are healthy for you. Let's give the clinicians the data so they feel comfortable. Let's teach people so that it becomes a part of the curriculum, so that people feel empowered with the data. And let's put it into one of the 4 toolboxes that every patient will be aware of and be privy to, that we can partner with our patients in this way, even in the under-resourced populations. This is a beautiful thing. It's a win-win for the field and for our patients, which is what we're trying to do and serve.
Yeah, well, beautiful said. So anyway, well, we're out of time today, but I want to thank both of you for joining us and generously sharing your passion, insights, and deep expertise. Thank you for taking the time to join us. And I want to thank our audience for tuning into this episode of Flip Your Script. We hope today's conversation has inspired you with practical insights on how lifestyle medicine is shaping the future of patient care. If you enjoyed this episode, don't forget to like, subscribe, and leave a comment. Stay connected with us for more episodes featuring clinicians who are rewriting the script on health, one patient at a time. Until next time, take action, make an impact, and keep flipping the script on healthcare. Thank you.